What if you want to clean the base of the umbilical cord? Let's talk about this in part 2. We talked about what a healthy umbilical cord looks like. No redness, no pus, no swelling, minimal, if any, bleeding, on for 2 weeks, falls off, you got all of that. In the hospital, they may have showed you how to clean the umbilical cord, but they probably went so fast that you don't even remember, and when you get home, the thought of touching it really makes you nervous. So let's go through the 10 steps of cleaning that umbilical cord. First, wash your hands. We will repeat that time and time again, because really, no matter what we do in medicine, washing hands is really probably the most important thing that we do. Second, make sure you have everything you need when taking care of that umbilical cord. You really don't need much. You need a cotton ball or Q-tip, you need some rubbing alcohol. Third, we're going to take a look at the skin around the umbilical cord. So simply take your hand, pull up a little bit, and take a look. Is it red? Is it normal? Is there pus? Is there drainage? Is it stinky? What's going on? If the skin looks completely fine, it's dry and it's not smelly, you really can stop at that point. You can simply do what we talked about in dry cord care and be done. But if it's a little bit irritated, if it's a little bit pink, if it's a little bit stinky, if it's a little bit moist, you might want to continue with the next steps. Fourth, you want to get the cotton ball or cotton swab out. And then fifth, you want to dab it in some rubbing alcohol. You don't need to drench it. You don't need to soak your baby. You just want to get a little bit on to clean the area. Next, take that cotton swab and wipe once around the area. You don't need to keep scrubbing the area. Just one nice clean wipe around that umbilical cord to get everything off. Lift up again, take a look, and if we still have some residue or it's still a little bit stinky or smelly, you're going to do that one more time. Dip a cotton ball or a cotton swab in some rubbing alcohol, do one nice circular motion around the base of that umbilical cord, make sure it's nice and clean, and then you're done at that point. Once the umbilical cord is nice and clean, you're going to fold up the diaper, throw away your swab, wash your hands one more time, and we are completely done cleaning the area. Very, very simple. Don't make it complicated. Sometimes, no matter what you do, that cord can become infected. So what does that look like? We'll talk about that in part 3. We love those shares, we love those likes, and remember, no stinky hands.